Okay, so for my final head to toe exam, I'm going to do it on myself. Before I would walk into the room, I would knock on the door to make my presence known. When I enter the room, I would step inside the patient's room and pull the curtain just to provide privacy for the patient. I would wash my hands and introduce myself. Hi, my name is Abby. I'm going to be the student nurse today taking care of you. I'm just gonna do a quick head to toe exam, and it should take no longer than 30 minutes. Can you confirm your name and date of birth for me? And then they would tell me their name and date of birth, and I would check it against their wristband to make sure that the information is correct. I would ask them if they're experiencing any pain at the moment, and if they have any allergies to any foods, medication, anything like that. So before I even touch the patient, I would just do a general exam on them. I would note that they are able to sit up and they don't look like they're having any distress. They're alert. Their orientation, I would determine by asking them their name, what time it was, if we had a clock in here, or if they had something on their cell phone to check against. What location that they're in. So they would either say the hospital or the doctor's office, whatever the appointment is taking place in. And then for situation, I can ask them what's going on in the world. So they can talk about the election, they can talk about COVID, stuff like that. And then just by like noting their facial expression and how they're speaking to me, I can note that they're in a good mood, they don't have a flat affect, they're able to hold a conversation with me, and that they, when they're talking back to me, answering my questions, I know that their language isn't slurred or anything like that, so they are able to have a conversation with me. Moving on, I would do the skin. So my patient would be in a gown and they would have exposed skin. So just by looking at their skin, I note that the tone is appropriate with their race. If I'm gonna check the temperature, I would just use the back of my hands and just run it down their arms and note that it's warm, dry, no lesions, wounds, incisions, anything like that. And then I would check the nails. So just looking at the nails, I note that there's a pink color to them. There's no cyanosis, so their oxygen is good through their circulation. Cap refill, I would hold it down and note that the pink color returns within 3 seconds. So that would be noted, and then there would be no clubbing, so no late signs of respiratory distress. For the head, I would just feel around on their head, kind of look through their hair, note that there is no incisions, any infestations, anything like that. They have good growth, hair growth pattern. I would note that the cranial nerve 5, that they can open and close their mouth and clench their teeth. So when I'm palpating all around there, and when they have their mouth clenched, I would note that they don't have any pain and they're able to clench their jaw, stuff like that. For their facial cranial nerve, I can note that they would raise their eyebrows or frown at me, be able to puff out their cheeks, and then like smile, show their teeth, that cranial nerve is intact. The cranial nerve 11 would be the accessory spinal nerve. So that would be with their shoulders. They'd be able to shrug their shoulders, and I can put pressure on their shoulders, and they would have good strength whenever they shrug their shoulders. They could also rotate their head and be able to do that. Next, we would do the eyes. I would have my pen light, and I would know that there's, just by visualizing their eyes, I would note that there's no redness or drainage around the eye. The sclera is a nice white color. There's no jaundice, no yellowing of the sclera. And then the conjunctiva is moist and pink in color. For checking the pupils, we do Perla. So I just would check for equal round, react to light, and then with accommodation. So by doing that, I would shine my pen light in their eyes and just watch the pupils dilate and constrict as I put the light in them. So they should constrict whenever I place the pen light in their eye. They should do that equally as I shine the light. They should be equal sizes, nice round shape. And then for accommodation, I would have them watch my pen light, bring it to their nose and bring it back to mine. And then if I have like a clock on the wall further away, I would do up close. And then I would have them look at the clock and tell me what time it was. So by doing that, I can do the Perla test just to check the pupils. I would check 3, 4, and 6 cranial nerves by the cardinal gaze of direction. So by doing that, I would take my pen light and I would move it in the directions and have them just follow it. And if they can move their eye with following in the 6 directions, then those cranial nerves are intact. For my ears, I would check, I could also use my pen light to check in the ears and just note around the ears that there's no redness or drainage in the ears. By doing the whisper test, I would check for cranial nerve 8. So by doing this, I would stand behind my patient. I would have them close the opposite ear that I'm standing behind, and then I would whisper something behind them. And then if they are able to repeat back to me what I said or whispered to them, then they have a positive whisper test. So, and I would also do that with the opposite ear. So I would do on this ear, and then I would do it on this ear, and they would hold the opposite ear that I am testing. For my nose, I could also use my pen light or just have them kind of turn their head back, look in their nose, note any deformities. The septum should be pretty symmetrical. There's no redness, there's no drainage of the nose. I could also palpate around the nose and ask them if they have any pain, but I would also check for pain whenever I'm checking for the patency. So to check for bilateral patency, I would just have them hold one nostril closed, and then if they can breathe out that, and then that'd be normal, and then do the opposite nostril. I can check the olfactory cranial nerve if I get a something scented that is familiar to them. So I would have them close their eyes, I would kind of waft it in front of their face, and if they are able to tell me like what the smell is, then their olfactory cranial nerve is intact, so their sense of smell. For their mouth and their throat, I can note, I would look at their gums. So I would have them kind of raise their lips so I can check their gums. I would check their tongue, so I'd have them stick out their tongue, kind of move it around, so I can look above and below and on the sides, and then I can check their tongue or their lips. So I'm looking for a nice pink color, and they're moist, they don't have any lesions or anything like that on the gums, tongue, and lips. So cranial nerve 9 and 10, I would check for like their gag reflex. I would have a tongue depressor, and I would have them kind of stick out their tongue, kind of lay that on there and just have them say ah. And then if the uvula moves up with the ah, then those 2 cranial nerves are intact. Then I would check for the cranial nerve 12. With this, I would have them stick out their tongue, kind of raise it up and down and move from side to side. They have good strength in their tongue, and then if they can say light, bright, dynamite, or something like that, pretty clear, then that cranial nerve is also intact. For respiratory, just inspecting the chest, I note that there's no like barrel chest. They aren't retracting, so they're not using their accessory muscles, and doesn't show that there had any signs of distress. When I'm listening to their lobes, I would do it in a Z pattern. So I usually would start with one side or the other, it doesn't really matter, using the diaphragm of my stethoscope. And I'm listening for any abnormal lung sounds. So I would go ahead and start with the left upper lobe, the right upper lobe, and as I'm listening, I would have them take a deep breath, so to hear the air move through the lungs. So left upper lobe, right upper lobe, and then we got, actually, I personally would start with the right side because I'm checking the right upper lobe, the left upper lobe, the right middle lobe, the left lower lobe, and the right lower lobe. So I would do that in a Z pattern with my stethoscope. So right upper lobe, left upper lobe, and then we got the right middle lobe, left lower lobe, right lower lobe. So I would also do that posteriorly as well. So I want to listen to all the lobes of the lungs in the front and in the back. So for cardiovascular, I would go ahead and first just observe the patient, note that they aren't like breathing really fast. That's usually associated with a higher heart rate. So I would check their jugular veins just as they're standing or sitting, and then lay them back to a 45-degree angle, and then I would check again just to note that there's no JVD. And then just as they're in a gown, I would go ahead and check their feet for any swelling, edema, their hands, anything like that. Just to check the symmetry of the extremities to make sure that one side isn't swollen compared to another. Also, whenever I am listening to any of the fields of the body, I would make sure that they're in a gown, so I would be listening on bare skin. So whenever I'm doing in the inspecting, after that, I would just go ahead and palpate any of the pulses. So I would start with the carotid, and I would just use my 2 fingers, excluding my thumb, and I would do this one at a time. And I would just check the rate and rhythm, and if it's like wiry or anything like that, or if it's like an abnormal rate or rhythm, then I would feel for a full minute if I'm counting to get the heart rate. But if not, I would just do it for 30 seconds and then multiply by 2. So one side and then check another side. For my radial pulses, which would be my thumb side, right about here, I could do that at the same time. So I would check my radial pulses. And then for my lower extremities, I have the dorsalis pedis, which is on the top of my foot. Right, I can't get up there, but right here. And then for my posterior tibialis, I would be internal, like right back here. While I'm checking the pedal pulses, I would look for edema down there as well. When I'm listening to heart sounds, I would use the diaphragm first, go through all of the points, and then I would switch to the bell and go through all the points again. So I would listen to aortic, pulmonic, Erb's point, tricuspid, and then mitral, which should be directly below the nipple line. And then again, switch to my bell, aortic, pulmonic, Erb's point, tricuspid, and again, the mitral. After assessing the cardiac system, I would move on to the abdomen and gastro. So what I would do is move to the side of the bed of the patient when they're laying flat, and I would just observe the symmetry or the contour of their abdomen. So I would note that it's just a normal concave abdomen. Sometimes if they're a little overweight, they'll have a little bit extra curvature, but we don't want to look for any like super like swelling associated with ascites, stuff like that. And then whenever I'm checking for symmetry, I would go to the end of the bed by the patient's feet and just look at the patient and note symmetry of the abdomen. When I am listening to bowel sounds, I would start in my right lower quadrant and move around as you're listening, following the direction of the large intestine. So with my diaphragm, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And I note normal bowel sounds are not hyperactive or hypoactive, just a normal slow gurgling of the belly. So it's not a constant gurgle, it's just here and there I hear a gurgle as my food is digesting. Next, I would go ahead and palpate. So I would always observe first, and then I would listen, and then I would palpate in case the patient is having any pain. I don't want to make the pain worse by palpating first and then have them be really uncomfortable with me doing the rest of my exam. So with light palpation, I would just start with the right lower quadrant and just kind of go all around in a circular motion in that quadrant, and then move up to the right upper quadrant, just above the umbilicus, and then to the left upper quadrant and left lower quadrant. And then you can go like under the umbilicus and then kind of in the upper pelvic area. I would note that there's no distension, and then whenever I'm palpating, there's no tenderness noted whenever I'm doing that part of the exam. So for musculoskeletal, I would go ahead and I am going to do my shoulder as my major, and then wrist as my minor, and then hips for my major as my lower extremities, and then ankles for my lower extremity of my minor. So what I would do, I would just have the patient stand there, kind of note the symmetry. One's not like way up high or lower compared to the other. And then the contour bilaterally, everything is pretty symmetrical. Again, with my wrist, I would just note that there's no swelling in one, they're symmetrical, the contour is the same, and bilaterally, it's all the same. Whenever I am noting the hips, my patient will be laying flat, and then, or they would stand up straight. So I can assess in both positions. Usually if they're elderly and they need a cane or something, I would have them probably lay down. But what I would do, I would just note symmetrical contour, and then bilaterally, and then again with my ankles. So whenever I'm checking their ankles, I would have them sit on the exam table and just kind of dangle their feet, or have them lay back with the bed up for me to examine their ankles. So then I would check their range of motion bilaterally. So I could do it, have them both you know, kind of raise their arms, move it out, move it backwards, up, out, and then just kind of do a circle, and then back. And then with their wrist, again, bilaterally, good range of motion. So down, up, left, right, kind of in a circular motion. For my hips, I would have them first lay down, and then I would, you know, kind of manipulate their legs and lift it up and kind of roll it out. And then again with my other hip, out. And then I would have them stand up, just position themselves against the bed so they have something stable to hold on to. And then they could just point their leg and bring it back and out to the side and back, up, down, back, and to the side. And with my ankles, I would do the same thing. I could have them sit on the exam table and have them point their feet, lift their foot up, and kind of rotate it around in a circle. And again, they're both symmetrical, and bilaterally they're symmetrical and have a good range of motion. So again, I would do it with my left ankle, and then point, lift it up, and then move it around in a circle. For my senses of my extremities, I could do, I would do it on bare skin, but I would have like a cotton ball, and then maybe like the tip of a cotton swab that I cut the tip off so it was a little bit more pointy. Nothing painful, but I would just slowly move it up and down the leg and the arm, and then just use like the toothpick or the cotton swab to kind of poke. And then at the bottom of their feet, I would poke so they can sense the pressure, and then light touch, stuff like that, pain. To check my upper and lower strength, I would put pressure on their shoulders and have them shrug their shoulders, and then that would tell me that they had good strength. For my wrist, I would put pressure on their hand, have them lift, and then below. With their hips, I would have pressure on one side of their hip, and they would have to push, and again on the other side, push their leg. And then with their feet, if their feet is like that, I would have the bottom of their foot point, and then if their foot is flat like this, lift up their foot. And that would show good strength in both extremities of the major and minor. When they first walked into the appointment, I noted that they didn't have any assistive devices like a cane or a walker. So that would tell me that they have a normal gait and they don't need any assistance. At the end of my assessment, I would ask them again if they're having any pain, if they have any questions about the exam, and if they didn't, I would thank them. I would wash my hands after finishing the assessment. I would make sure the bed is at the lowest and it was locked, and if they need any restraints or railings, I would put the first two railings up, and then the bed would be within distance of the call light. So after that, I would thank them for their time. I would wash my hands before I would walk out of the room, and then I would step out of the room.